Hello, my name is Dr. Diwan S. Raja. Today I will discuss about epistaxis or nose bleeding. Epistaxis or nose bleeding is a very common condition, and we must know what is the common site of epistaxis. Common site of epistaxis. Okay. Common site is the Little's area that is located on the anterior inferior part of the nasal septum. And this area, Little's area, contains the Kiesselbach's plexus. Kiesselbach's plexus. Okay. So Kiesselbach's plexus, we have multiple arteries come together in this area. This is the Little's area. This is the nasal septum. And nasal septum is formed by multiple bone and cartilages like that of the vomer bone. Is the vomer. This is the perpendicular plate of ethmoid bone, cribriform plate of ethmoid bone, small part from the frontal bone, from the nasal bone, and this is the septal cartilage, another cartilaginous process here, small part here. So this forms the nasal septum. If you go to the anterior inferior part, we'll get the Little's area. Little's area is formed by the anastomosis between multiple arteries. We call it Kiesselbach's plexus. Okay, arterial anastomosis. Arterial anastomosis in the Kiesselbach's plexus. Kiesselbach's plexus. Okay, the arteries are contributing are the superior labial branch of facial artery, okay, that is this artery, number one. Number two, we have the greater palatine artery, greater palatine artery. It may come to the floor of the nose, may participate in the Kiesselbach's plexus. Palatine artery. Okay, it enters the floor of the nose through the incisive canal here. Okay, this is a branch of maxillary artery. We have the sphenopalatine artery. This is number two. Okay, number three is the sphenopalatine artery. Sphenopalatine artery. Then we have the posterior ethmoidal artery here. Posterior ethmoidal artery. Ethmoidal artery. And we have the anterior ethmoidal artery. These are the anterior ethmoidal artery. These are branches of the ophthalmic artery, and ophthalmic artery is a branch of the internal carotid artery. Okay, so anterior ethmoidal artery. Okay, we got the artery contributing to the formation of Kiesselbach's plexus in the little's area on the anterior inferior part of the nasal septum. Okay, how can you remember the artery? Artery is, you can remember in this way. This is the greater Platen artery. Okay, so great lake means labial, superior labial artery, branch of facial artery, SPA, S-P-A, SPA, sphenoplatean artery, posterior ethmoidal artery, anterior ethmoidal artery. So this is my mnemonic. You may use your own mnemonic. Great Lake SPA. Great means greater Platen artery. Lake means labial branch of the facial artery, superior labial branch. This is the SPA, sphenoplatean artery, branch of maxillary artery, posterior ethmoidal artery, branch of the ophthalmic artery, branch of internal carotid artery. This is anterior ethmoidal artery, branch of ophthalmic artery, that is a branch of internal carotid artery. We got that. The site of hemorrhage, Kiesselbach's plexus, and the artery forming Kiesselbach's plexus. So now we go to the causes of epistaxis or nose bleeding. Okay, there are many causes. Most important is that it may be idiopathic. We don't know the cause. It may happen suddenly to some individual. Okay, it may happen to the children. It may happen to the adult. Okay, it may be idiopathic, unknown cause. It may be due to trauma, any type of trauma. Trauma may be nose pricking, trauma due to body contact sports, trauma due to boxing or any other game with the body contact. Okay, trauma due to some type of violence or physical altercation. Okay, any type of trauma. Okay, it may be due to any type of tumor. Okay, so tumor anywhere, tumor in the lateral nasal wall, not necessarily in the septum of the nose, in the paranasal sinuses, tumor in the nasopharynx. Okay, so any part of the nasal cavity, nasopharynx, tumor, there may be bleeding from that side, and that may lead to epistaxis, tumor. Okay, so we got that. Then we go to the infection. Infection like that of rhinitis, inflammation of the nose, rhinitis. Okay, like that of rhinitis. Okay, so it may be a complication of the deviated nasal septum. Nasal septum is not perfectly in the midline, it should be, but in most people it is little bit deviated. Okay, that may be associated with blockage of the nose, rhinitis, and that may lead to epistaxis. Okay, we may have infection, some type of special type of infection like that of rhinosporidiasis. Okay, so that is a special type of infection, that is a granulomatous inflammation, granulomatous inflammation or inflammation, and it contains giant cells. So Rhinosporidia seaberry, the causative agent. Now its taxonomy is very much confusing. Previously it was called fungus, then it is a type of protozoa. Now it is called protista aquatic parasite. Okay, that is present in the stagnant water, and in the rural aquatic area it is very common in South India like Orissa, Kerala, Tamil Nadu. Okay, and also in Sri Lanka, very common, but it may happen to any part of the world. Okay, so that may lead to polyp formation. So any type of polyp, nasal polyp, not necessarily due to rhinosporidiosis, maybe other type of polyp. Okay, that may lead to epistaxis. Okay, epistaxis may be as a complication of hypertension. Okay, hypertension. It may be a complication of chronic renal failure. Chronic renal failure. Okay, hepatic disease. Hepatic disease. It may be a complication of blood dyscrasia. Blood dyscrasia. Okay, dyscrasia, blood dyscrasia, or some type of bleeding disorder. Okay, so any type of bleeding or hemorrhagic disorder. Bleeding disorder. Okay. So there are many causes. It may be associated with substance abuse. Substance abuse, like that of alcohol or cocaine. Alcohol, cocaine. Okay, even with amphetamine that causes high blood pressure. Okay, so substance abuse like alcohol, cocaine, or anything else. Okay, it may be due to some medication like NSAID, like ibuprofen. Okay, maybe aspirin, NSAID drug. Okay, so that may lead to epistaxis of bleeding, and it may be associated with that of pregnancy. So for some reason during pregnancy, blood vessel, due to overactivity of the or the above activity, physiological activity of the hormone, there may be the blood vessel may be fragile. Okay, so epistaxis may be due to dry atmosphere, dry and hot atmosphere. Okay, atmosphere. Okay, that is possible. So there are many causes of epistaxis. Most common cause we can say minor trauma, or it may be idiopathic. Okay, so we have add one more important point, that is called vicarious menstruation. Vicarious menstruation, especially it is seen in female during menstrual period. Menstruation. Okay, during menstrual period there may be hemorrhage from the nose. It may be related to some ectopic endometrial cell that develop outside the uterus, that may be changed during the menstrual phase of menstrual cycle. Okay, so there are many causes of epistaxis. Okay. So we got that, the causes of epistaxis, we got the location of epistaxis. Now what is the laboratory work? Lab work. So we must do the CBC, complete blood count. Okay, we look for the thrombocytes, and the bleeding time, and also the clotting time, bleeding and clotting time. Okay, we look at that, and we must do the blood grouping and cross matching. Blood grouping and cross matching. Okay, so if it is required, it is not so much severe usually it is a mild problem, but it may need hospitalization and blood transfusion on rare occasions. We must ready for that. So we can do CT scan to diagnose any type of tumor, any problem in the nasopharynx. Usually anterior inferior part is the common site, but there may be problem in the sinuses, there may be sinus tumor, there may be problem in the nasal cavity. Even you may do CT scan to identify a tumor or any type of bony fracture or foreign body. So we may need to do the CT scan. Okay, once we have done, we have diagnosed the epistaxis. So what is the management of epistaxis? Management of epistaxis. What is the management? Management is very simple in most cases. Management that is done very easily just by pinching the nose by thumb and the index finger, and patient is sitting in a comfortable position and the head is down, mouth is open. Patient will breathe by mouth, and we must pinch the nose by index and finger and thumb for around 10 minutes time. So that is the management. So pinching the anterior part of the nose by the index finger and the thumb, okay, for about 10 minutes. Okay, there is a management. Usually the bleeding should stop, but we may look any other thing that we can do. So idea is that if that does not close, you must look at the bleeding point. So we may put some type of vasoconstrictor with a local anesthetic, okay, with local anesthetic like lidocaine plus epinephrine, okay. So that is given. Idea to do vasoconstriction, and there is any pain should be disappeared. Okay, it should be soaked by a cotton gauze we can place inside the nose, so the bleeding should be disappear. If that does not work, then we go through cauterization by silver nitrate, or we can go through, if that does not work, electrocauterization. Okay, and it may need to put nasal sterile baseline gauze packing, anterior nasal packing, posterior nasal packing, and it should be those packing should be taken out after 48 hours to 72 hours, and person should be under antibiotic coverage so that there should not be sinusitis or secondary infection. So we may have anterior nasal packing or posterior nasal packing depending on the situation. Anterior nasal packing. Okay. So we got the management, and for the severe cases or moderate cases, it is wise to consult with the ENT specialist who is specialized in this field. So that's all about epistaxis. If you like my video, please support my channel. Please subscribe me share the information with your friends, and have a nice day. Bye now.